Okay, so as this is a session of rapid revision just before your examination, so before starting the session, I would like to introduce myself Dr. Monalisa, faculty for your anatomy subject. So, we will start with general anatomy. Actually, a quick revision before the examination is required. So, a rapid revision of 9 to 10 hours will be done. So, for general anatomy, what happens? Many students keep this very important subject, general anatomy. Many questions are directly from general anatomy and general features as very important for you to know. So, I will complete this topic with the means of MCQs. So, we are going to have a fast track revision of all the important points, which will be from all the important aspect of general anatomy, so that you can solve as much as MCQs has been asked from these topics in your examination. So, let's start with the first MCQ, and this session will be highly beneficial for you because this session is not only the theory part. The theory part, which is very, very important, I will describe. Otherwise, we will go with MCQs because we have got less time and we want to acquire much more marks so that we can click this exam in the first go. So, let's start with this. All the best, my dear aspirants. So, I would like to start with the first MCQ. Let me read it for you. Vasa vasorum provides a functional analogous to which of the following? The option provided is valves, basal lamina, coronary arteries, endothelial diaphragm. So, for solving this MCQ, so first thing is that whenever an MCQ comes, if you are not knowing also, you have to rule out certain important options which is given. Okay. So, either the fact is that you are knowing the answer, the other fact is that you are not knowing the answer, then also you can rule out the options which is provided. So, here the keyword which is very important for you to note down is the word vasa vasorum. So, if you are knowing the meaning of vasa vasorum, it becomes very easy for you to understand the correct answer. So, here the MCQ is asking that the function of vasa vasorum will be similar to which of the following structure. Now, my dear aspirants, we know that valves can't be the answer because valves, if I am talking about the valves, they are present in the veins for unidirectional blood flow. Now, the other important point about vasa vasorum is that it is small arteries and very small arteries which is in the outermost layer of the large arteries or large vein for providing nutrition. So, it is not having the role. So, exactly if I am talking about vasa vasorum, the important function of it is providing nutrition. So, definitely valves, we know that valves has a function of providing unidirectional blood flow. What do you mean by the word unidirectional? When I am using the word unidirectional, it means the blood should flow from superficial vein to deep vein. Basal lamina is also not correct because it is acting as a resting membrane on which the other layers are attached. Endothelial diaphragm is also not the right answer. The reason is that why endothelium diaphragm is not the right answer, because endothelium diaphragms are the small slits which is present in the endothelial layers. The correct answer will be coronary arteries. Now, I know that the fact is that coronary artery has got a function of providing arterial supply and nutrition to the musculatures of the heart. What is the function of coronary artery? It is giving nutrition to that of the heart. So, we know that we have got right and the left coronary arteries and it is providing nutrition. The same goes with the vasa vasorum. Vasa vasorum are the small blood vessels residing in the outermost layer of the tunica externa or tunica adventitia. That means the correct answer or the function of vasa vasorum will be similar to that of coronary arteries. I think everyone is clear with this. Now, my dear aspirants, the same thing. I will show you multiple images and you can revise the session by seeing these images so that your concepts are clear. What I told you, vasa vasorums are the vessels which is predominantly residing in the outermost layer of large arteries and large veins. Outermost layer of large arteries and large vein. When I am speaking this term, I mean to tell that the outermost layer, as we know, there is tunica intima, media, tunica adventitia. There is the outermost layer is called as tunica adventitia or it is called as tunica externa. So, vasa vasorum are small vessels residing in the outermost layer of the large vessels. The function of vasa vasorum is to provide nutrition, oxygenated blood to the thick media and adventitia of these vessels, which are unable to obtain. If we talk about these, actually what happens? So please try to understand the concept. If there is a large vessel, large artery is there, for example, large artery like ascending aorta is there, the thickness of the valve is the thickness of the wall of these arteries are large enough, so the blood which is flowing in it is not enough to give nutrition to the outermost layer. Okay, the nutrition for the inner layer of the blood vessel is adequate, but the outer layer is not adequate. Means उसके पास इतना न्यूट्रिशन है ब्लड के पास, लेकिन आउटर मोस्ट लेयर तक वो न्यूट्रिशन नहीं पहुंच सकता, इसीलिए वहां पे छोटे वेसल्स होते हैं, एंड these small vessels are called as vasa vasorum, residing in the outermost layer of large artery and large vein. The same and the similar function is done by coronary arteries. This coronary arteries is also having this similar function in case of providing nutrition to myocardium. Okay, clear? Now, my dear aspirants, let's see the image. Let me just enlarge this, and when I am enlarging this, you can clearly see that the layers has been shown. So, this is a histological image. So, let me slightly enlarge it. Can you see here? So, just concentrate. I am just enlarging this histological image, and I think the image is very clear, and you can clearly understand that if I am talking about this part, this is the lumen, this is the tunica intima layer, this is tunica media layer, and the outermost layer, as I told you, is adventitia. The outermost layer of large arteries or large veins are adventitia. Now, can you see small vessels are residing in the outermost layer? That small vessels are called as vasa vasorum. So, I think your concepts are cleared and you are knowing the function of vasa vasorum. Now, let's talk about the second question. Nutrient artery runs in. So, the option provided are towards metaphysis, okay, towards metaphysis, away from the metaphysis, away from the epiphysis, or none of the above. So, we have got 4 options and we have to mark the right answer. Nutrient artery runs in. So, 4 options are there, and whenever you want to have this correct answer, it's important that you should just go through this options and you can be very easily knowing the correct answer. So, nutrient artery runs. When I am talking about this, nutrient artery runs towards metaphysis will be the right answer. Now, the direction of nutrient artery, if I am talking about the nutrient artery, what is the function of nutrient artery? So, actually what happens in case of long bones, there is nutrient foramen through which nutrient artery get inside, and it is very important for these arteries to provide nutrition to the long bone. So, the direction of this nutrient artery is towards metaphysis, and that is the right answer here. So, I would like to show you this image. Let me slightly enlarge this. So, you can see this is the cut section of long bone, okay. So, long bones in case of femur, humerus, tibia, fibula, they are all example of long bones, and you can clearly see the nutrient artery, nutrient vein are traversing through the interior of the long bone, and this nutrient artery, if you will see, the direction is towards the metaphysis. So, the direction of nutrient artery is always towards metaphysis, which is an important area for the growth of the long bone. So, the correct answer will be towards the metaphysis. Now, coming to the third question. Okay, so in this third question, which of the following is an aberrant epiphysis? This was the question being asked, which of the following is an aberrant epiphysis? So, here we have seen the correct answer is base of second metacarpal. 4 options are there given: coracoid epiphysis, greater tubercle of humerus, base of first metacarpal, base of second metacarpal. Now, what happens? We know that if I am talking about aberrant epiphysis, the correct answer will be head of first metacarpal, but that was not given as an option. So, definitely the correct answer will be base of second metacarpal. We know that epiphyses are of 4 types. So, there is pressure epiphysis, there is traction epiphysis, there is atavistic and aberrant epiphysis. Okay. Now, my dear aspirants, let's understand each of it. Now, as I have told you, the aberrant epiphysis means abnormal location of the epiphysis. Okay. So, abnormal location of the epiphysis is found for the head of first metacarpal, and that is an example here. But the head of first metacarpal was not given as an option. So, definitely the correct answer here, it can be present at the base of second metacarpal, is the right answer. Now, pressure epiphysis. When I am talking about pressure epiphysis, these are the epiphysis present at the end of the bones which are involved in joint formation and weight transmission. So, head of humerus, head of femur, these all becomes the example of pressure epiphysis. When we are using the term traction epiphysis, it means it is giving attachment to muscle, tendon and ligament. So, it is not exactly involved in formation of the joint, but it is having an attachment of ligaments or any kind of muscle tendons. So, traction epiphysis, the best example is the lesser and the greater trochanters, lesser and the greater tubercles. So, lesser and greater trochanters of the femur, lesser and greater tubercles of the humerus, these are example of traction epiphysis. When I am using the word atavistic epiphysis, atavistic epiphysis means they are exactly an example of a different bone, but these bones has fused with the part of other bone, forming one compact bone. So, in that case, posterior tubercle of the talus or strigonum, coracoid process of the scapula. So, the reality is that when I am talking about the coracoid process of the scapula and the posterior tubercle of the talus, these two has to be the part of different bone but has fused with the part. For example, coracoid process has been fused with the scapula, and the posterior tubercle of the talus is also a part of different bone, but in case of human beings, they are the part of talus bone. So, these two examples, that is the ostrigonum of the talus and the coracoid process of scapula, becomes an example of atavistic epiphysis. So, got the right answer. So, which of the following is an example of aberrant epiphysis? Here the correct answer will be base of second metacarpal. Now, my dear aspirants, let's move on to the next, that is the question number 4. Let me just enlarge this. Let me first read it for you. Which type of joint is growth plate? Growth plate, a growing bone and is having a growth plate. So, only you must have seen many of the hakims and those who are not doctors, but they mean to tell that yes, you can just take this pill and you will have your height increased by 2 centimeters, by 3 centimeters, but that is not possible, because we know that once the fusion of diaphysis, epiphysis has been done, growth plate has all been ossified, then the further growth of bones is not possible. So, which type of a joint is growth plate? Whether it is fibrous joint, whether it is primary cartilaginous joint, whether it is secondary cartilaginous joint, or whether it is a plain joint. So, 4 options are there and we have to mark the right answer. Which type of joint is a growth plate? The correct answer is primary cartilaginous joint. Please, my dear aspirants, please note down primary cartilaginous joint. Other example is synchondrosis. It is also called as synchondrosis, and definitely the correct answer will be primary cartilaginous joint. Actually, when I am using the word primary cartilaginous joint, which is also called as synchondrosis, it is present in the growth plate of the growing bone, and after some time it get ossified. Now, what happens? There is a hyaline cartilage present there, and when in between the hyaline cartilage there is a presence of fibrous cartilage, it becomes secondary cartilaginous joint. All the joints which is lying in the midline are example of secondary cartilaginous joint. Plain joint, fibrous joint, all these are wrong option, and the correct answer for the growth plate is primary cartilaginous joint. So, the correct answer is primary cartilaginous joint. Now, I would like to show you this image where you can see the shaft of the bone, that is the diaphysis. Then we have got that ends of the bone is epiphysis. In between diaphysis and epiphysis, we have got metaphysis. Now, to be more precise, just see this diagram when I am enlarging it. So, I am just removing all other labeling so that you can just focus on the growth plate. So, you can see here, this is the growing long bone which is shown in this diagram. The ends of the bone is epiphysis, and at the epiphyseal end of diaphysis, we have got metaphysis. So, a growth zone has been shown. Can you see here? This growth zone is called as epiphyseal plate of cartilage, and this epiphyseal plate of cartilage is an example of primary cartilaginous joint. The other name which is used for primary cartilaginous joint is, it's an example of synchondrosis. Okay, let's move on to the next MCQ. Metacarpophalangeal joint. Metacarpophalangeal joint is an example of condylar joint. It's an example of saddle joint. It's an example of hinge variety of joint. It's an example of ellipsoid joint. Now, one more thing I want to tell, that all the option which is given here, whether I go for condylar, whether I go for saddle, whether I go for hinge or ellipsoid, all are the example of synovial joints. What do you mean by synovial joint? Synovial joint means it's a movable joint. Okay. So we have got 4 options. Metacarpophalangeal joint. The joint between the metacarpals and the phalanx is called as metacarpophalangeal joint. Metacarpophalangeal joint, if I have to mark the most correct answer, I will definitely go with ellipsoid. Now, my dear aspirants, there is some students may be telling that, ma'am, the correct answer is condylar. Please note down that to be more precise about the metacarpophalangeal joint, when we want to know exactly what is its type, functionally metacarpophalangeal joint is ellipsoid variety of synovial joint. Structurally, metacarpophalangeal joint is condylar variety of synovial joint. So, please note down this. So, this is a very important point. Please don't get confused because this was previous year MCQ and the concept should be clear. Everybody, please note down. Metacarpophalangeal joint. Metacarpophalangeal joint is structurally example of condylar variety of synovial joint. But when I am talking about its functional classification, so functional classification, it is an example of ellipsoid variety of synovial joint. Okay, metacarpophalangeal joint. So, the best answer of metacarpophalangeal joint, the correct answer for it will be functional classification, and we will go with the best answer among the option provided. So, the correct answer will be ellipsoid variety of synovial joint. Okay, my dear aspirants, let's move on to the next MCQ. Now, which of the following is a holocrine gland? The option provided is sweat gland, breast, pancreas, sebaceous gland. 4 options are there and we have to choose the right answer. Which of the following is a holocrine gland? Now, the holocrine gland, the best answer will be sebaceous gland, but I would like to explain that what do you mean by the word holocrine gland? Actually, according to the mode of secretion, the glands is divided into 3 types, that is the merocrine, the apocrine and the holocrine. We will come to the correct answer. Actually, the correct answer is sebaceous gland, but let me explain it more in detail. The correct answer is sebaceous gland. Now, see here. Actually, I told you according to the mode of secretion, just go through this image. I just want to enlarge this. Okay. Can you see here? There are 3 images, A, B, C. A, B, C. So, what you can see here that the secretion. So, you can see here the mode of secretion is that the secretion is secreted, and you can see the cell is intact, not a part of cell is disintegrated in this process. So, such kind of glands are called as merocrine. So, that means the B gland is merocrine gland, in which not a single part of the cell is distorted in the process of secretion being provided. But when we are talking about the apocrine gland, the C is apocrine gland, in which a portion of the cell is pinched off during the process of secretion, is apocrine gland. The third variety which I am talking is the holocrine gland, and in this category what happens, the disintegrating cell and its secretion is whole disintegrated in this process and new cell is formed. So, holocrine gland example, best example is sebaceous gland. So, definitely the right answer will be sebaceous gland. Now, here in the options, if I talk about sweat gland is merocrine gland. Breast is an example of apocrine gland. Pancreas is an example of both exo plus endocrine gland. And sebaceous gland is an example of holocrine gland. So definitely in this MCQ, we have to choose the right answer. And which of the following is the best example for holocrine gland? Definitely we will go with option D, sebaceous gland. Okay, my dear aspirants, now, okay, let me tell you the same thing which I have explained you has been written here. Exocrine gland are named when I'm actually, there are two types of gland, in which one is exocrine and the other is endo. Okay, endo means the secretion is directly poured into the blood, and exo means there is a duct for the secretion. So exocrine gland is again based on the how the product is secreted. It is divided into three types. What I told you, mero, apo and holocrine. So it is of apocrine type, holocrine type and merocrine type. When I am talking about merocrine gland, in this merocrine gland, the cell secretes its substance by the process of exocytosis into the duct, and the example of merocrine glands are pancreatic acinar cells, maximum number of sweat gland except the sweat gland residing in the pubic area and the axillary regions, goblet cells, intestinal cells, tear glands, salivary glands. All these secretion, that means major category of secretion done by these exocrine gland is of merocrine type. The examples will be pancreatic acinar cells, sweat glands all over the body except that of the pubic areas and that of the mammary areas and that of axillary areas, salivary gland, goblets and intestinal tear glands. Okay, if I am talking about apocrine gland, what I told you, a portion of the cytoplasm or cell membrane of the cell is distorted in the process of secretion. That means apical portion of the cytoplasm or the cell membrane is distorted in the process of secretion. An example, best example of apocrine is sweat gland in the armpits, in the pubic area, the skin around the anal area, nipple, lips and the mammary gland. So all these examples, please my dear aspirants, just by heart these examples. These are all example of apocrine gland. The third variety is of holocrine gland. Let's talk about holocrine gland. What I told you, in this process, entire cell ki death ho jati hai. The entire cell is disintegrated, and for new secretion, the new cell has to be renewed, has to be formed. So the entire cell disintegrates to secrete the substance, and the example will be sebaceous gland. The example is sebaceous gland, which was given in the MCQ. So it is the right answer. Of the skin, nose, meibomian glands, chest gland of the eyelid. So sebaceous gland, the best example. Meibomian gland, chest glands of the eyelid, all these are examples of holocrine secretion. So done with this, let's move on to the next MCQ. Dense irregular connective tissue is found. We know that connective tissue is a very important structures giving strength, support, and when what happens, this connective tissue can be divided into dense, into loose type, into irregular or regular type. Now, here the MCQ is asking which of the following is dense irregular connective tissue example. Now, what are the examples given, my dear aspirant? The examples are, or the options are dermis, lamina propria, tendons and ligaments. My dear aspirants, we know the skin is having epidermis, and just beneath the epidermis, we have got the dermis layer. The dermis layer of the skin is consist of dense irregular connective tissue. So definitely the right answer will be dermis. Why not lamina propria? So dermis is an example of dense irregular connective tissue. When I am talking about lamina propria, it is loose connective tissue. It is loose connective tissue. It is loose connective tissue. This is the connective tissue. Tendon, ligaments, all these are dense, regular connective tissue. They are regular. Here the collagen fibers and all have got the regular arrangements. So irregular arrangement, when you see the arrangement of the fibers, of the collagen fibers in case of the dermis part of the skin, it is irregular, so it is called as dense irregular connective tissue. So the correct answer, dense irregular connective tissue, is found in the dermis layer. Now done with this, let's move on to the next. Okay, all of the following is an example of traction epiphysis except. The option provided is whether the right answer is mastoid process, whether the right answer is greater trochanter of femur, lesser trochanter of femur or deltoid tuberosity. Deltoid tuberosity. Okay. Now, my dear aspirants, we have got 4 options and we have to choose the right answer. Example of traction epiphysis. Now, we know that the mastoid process, greater trochanter of femur, lesser trochanter of femur, all these have, we know that traction epiphysis has got the attachment of muscle, tendon or ligaments, which is giving tractional force to it, and it is not involved in formation of the joint. And this is very important. So actually, if you will see the location of deltoid tuberosity, you must be knowing that deltoid tuberosity is a part of which bone? It's a part of humerus bone, that is a long bone, but it is not present at the ends of the bone. It is present in the middle portion of the bone. That means deltoid tuberosity is the part of diaphysis of the bone. It is not an epiphysis. So the odd man out and the correct answer is D. The correct answer will be D because traction epiphysis, here the question is asking about epiphysis, not about diaphysis, and deltoid tuberosity, part of a humerus bone where the deltoid muscle is inserted that V-shaped ridge is there for the attachment of the deltoid muscle in the shaft of the humerus, that is called as deltoid tuberosity, and that is diaphysis of the bone, not the epiphysis of the bone. Epiphysis of the bone is always present in the ends of the bone. So the correct answer and the odd man out will be deltoid tuberosity because it's a part of diaphysis, not the epiphysis. Rest all are example of traction epiphysis. Got it? Yeah. Now, here again the same thing which I want you to show. The pressure epiphysis are present at the ends of the bone where the joint articulation takes place, head of femur, condyles of tibia and condyles of femurs, head of femur, head of humerus. Traction epiphysis on the greater and lesser trochanter of the femur or greater and lesser tubercles of the humerus bone. Also on the mastoid process of the mandible. Posterior tubercle of talus, coracoid process of scapula, or examples of atavistic epiphysis, aberrant epiphysis for present at the head of first metacarp. We have discussed this. So this was a related MCQ and you can see how the MCQ can be twisted. Now let's see the next one. Perosteum is attached to the bone by. Perosteum is attached to the bone by. Okay. The perosteum is attached to the bone by. The option A is peripheral laminae. B is Purkinje fiber, C is elastic fibers, D is Purkinje fibers. So we have to mark the right answer. What is the attachment of perosteum? So we know that bone is having an outer covering, that is the perosteum, and this attachment of the perosteum and the bone is done by some of the fibers. So you can just mark the right answer. Here 4 options are there. So what you can do when you are seeing the video, those who are not live, they are seeing it afterwards, they can pause the video and they can mark the right answer and then they can come to the explanation of the right answer. Here the right answer will be Purkinje fiber. So peripheral lamina, these are seen in the cut section of the bone, and we know that when you cut the section of a compact bone, there are laminas in which the osteocyte cells are arranged in the lacunae. So we have got concentric laminas, we have got peripheral lamina. So obviously the right answer is not the peripheral lamina. Elastic fibers are present in large arteries. It is present in the elastic cartilage. Purkinje fibers is also not the right answer. It is present in the cells of cerebellum. So the right answer is Purkinje fiber, which is forming a connecting link between the perosteum and the interior of the bone. Now, my dear aspirants, I will show you this image. So very nicely you can appreciate that this is the Purkinje fibers which is arising from the perosteum or the outer covering of the bone, and this is forming a connecting link for the Purkinje fibers to get connected to the interior of the bone. So perosteum is the outermost layer of the bone, which is having 2 layers, the cellular and the fibrogenic layer, and these perosteum is connected by Purkinje fibers to the interior of the bone. You can see the lacuna is the reason where we have got the cells. Osteoblast is the immature one, the mature one is the osteocytes, and you can see the cells are arranged in concentric laminas like this, and the whole of this circle is called as Haversian canal or the osteon. Okay, also the inside we have got what we can see the Haversian system. Inside inside you can see there is a rounded area which I have shown you, that is the Haversian canal. So Haversian canal is connected via Volkmann canal, and this is the compact bone. So in compact, this is the histological part of the compact bone. So it is quite clear the perosteum fibers getting connected to the interior of the compact bone is via Sarpes fibers. Okay, the laminas are the regions where the osteocytes resides in the lacunae, and in this one osteon center we have got osteon. The other name of osteon is, it is also called as Haversian system. It is also called as Haversian system. In the interior, we have got Haversian canal through which nutrition is given to the compact bone, and the Haversian canal is connected to the adjacent Haversian canal by the connecting link called as Volkmann's canal. Now let's move on to the next. All of the following are composite muscle except. Now, the concept of composite muscle means hybrid muscle. Okay. The option provided is pectineus, flexor carpi ulnaris, bicep femoris, flexor digitorum profundus. Now, all of the following are composite muscle except, so we have to mark the odd man out. When I am talking about composite, the word composite muscle is also called as hybrid muscle. Now, composite muscle and hybrid muscle means they have got dual nerve supply. Now, in this case, when I am talking, so let's move on to the options provided. So, in this case, when I am talking about the pectineus muscle, the pectineus is getting innervation via both femoral nerve and that of obturator nerve. We know that femoral nerve is the nerve of anterior compartment of thigh. Obturator nerve is the nerve of medial compartment of thigh. The key feature of pectineus is it's an example of composite or hybrid muscle having dual nerve supply. It gets innervation from the femoral nerve, branch from the trunk of the femoral nerve, and also innervation from the anterior division of obturator nerve. When I am talking about flexor carpi ulnaris, it is getting innervation from ulnar nerve, only one nerve. So, it is not an example of composite muscle. Flexor carpi ulnaris is getting innervation by a single nerve, ulnar nerve. So, it is not an example of composite or hybrid muscle. When I am talking about the biceps femoris, it is getting innervation from common peroneal nerve and also the tibial nerve. Actually, common peroneal component of sciatic nerve gives innervation to short head of biceps femoris, and tibial component of sciatic nerve is giving innervation to long head of biceps femoris. Same goes with flexor digitorum profundus. It is getting innervation from both median nerve and ulnar nerve. So, let me write it for you, all the options. So, please write down. Pectineus is the muscle which is getting innervation from femoral nerve and also from the obturator nerve. The other was biceps femoris. When I am talking about biceps femoris, it's also an example of hybrid muscle, the short head and that of long head. We know that biceps femoris is having two heads of origin, short head and long head. When I am talking about short head, the short head is getting innervation from common peroneal component of sciatic nerve, and long head is getting innervation from tibial component of sciatic nerve. Long head is from the tibial component of sciatic nerve and short head of biceps femoris is from common peroneal component of sciatic nerve. The third muscle was flexor digitorum profundus. So, this is the deep muscle of the front of forearm, and its medial part is innervated by ulnar nerve and its lateral part is innervated by median nerve. To be more specific, AIN, anterior introosseous nerve, that is deep branch of median nerve, is giving innervation to the lateral part of flexor digitorum profundus. So in other words, it's quite clear that flexor digitorum profundus, one of the deep muscle of the flexor compartment of the forearm, getting innervation from two nerves, the medial part by the ulnar nerve and the lateral part by the median nerve. Now done with this. Now before proceeding to the next MCQ, as this is very important for all my students, and many times the MCQ has been asked from this topic, so you should know the list of the muscles getting innervated by the list of the muscle which is in the list of hybrid category. So please note down, these are the most important muscle of the hybrid or composite muscle, trapezius muscle. The first is the trapezius muscle getting innervation from spinal accessory nerve and also from the ventral rami of C3 and C4. So it is also getting proprioceptive fibers or innervation via ventral rami of C3 and C4. Now, the next is the digastric muscle. The digastric muscle, anterior and posterior belly. So we know that digastric muscle is having anterior and posterior belly. And if I talk about digastric muscle, anterior belly, it is getting innervation from the trigeminal nerve, mandibular division. Facial nerve is giving innervation to the posterior belly. Brachialis muscle, the muscle of the front of arm, is also having dual nerve supply. The musculocutaneous nerve, the nerve of anterior arm, and the radial nerve giving proprioceptive fibers. Flexor digitorum profundus, already we have talked that the 12 nerve supply is via median nerve, lateral half and ulnar nerve giving innervation to medial, the ulnar nerve giving innervation to medial half. Flexor pollicis brevis and opponens pollicis, these are the two muscles of the hand. These are the two intrinsic muscles. They are hand intrinsic muscles. So please note down these two muscles of the thenar region. We know that this is the thenar eminences where we have got three muscles. We have got abductor pollicis, we have got flexor pollicis brevis and opponens pollicis. In this category, flexor pollicis brevis, opponens pollicis is getting dual nerve supply via both median and ulnar nerve. So they are also example of composite muscle. Iliacus and psoas is getting innervation directly from the anterior rami of L1, L2 and L3 and also from the femoral nerve. Pectineus, we have already talked, it is getting innervation from both femoral and that of obturator nerve. Biceps femoris, we are already knowing that short head via common peroneal nerve and long head by tibial component of sciatic nerve. Adductor magnus, my dear aspirants, the adductor magnus is the bulkiest muscle of the medial compartment. It's the bulkiest muscle, and this adductor magnus muscle, which is the bulkiest muscle of the medial compartment or the adductor compartment of thigh, is having two parts. It is having a origin from the ischial head, or it is having an origin from ischial tuberosity of the hip bone, which is forming the hamstring part. So ischial part or hamstring part is getting innervation from tibial component of sciatic nerve, and the adductor compartment or the adductor part of adductor magnus muscle is getting innervation from obturator nerve. So in this we have seen a list of muscles. So please by heart this list. It is very important for MCQs, and definitely MCQs can be asked from this topic. So do by heart these all muscles which are an example of hybrid or composite muscle having dual nerve supply. Done. Let's move on to the next. All of the following are digastric muscle except. Options are occipitofrontalis, sternocleidomastoid, omohyoid, muscular fibers in the ligament of Treece. My dear aspirants, I want everybody to please note down that when I am using the word digastric, it means two bellies. The word digastric means two bellies. So, my dear aspirants, we know that, now coming to the answer, we know that the occipitofrontalis muscle is having occipital belly and that of frontal belly. So, that means it is not an example of digastric muscle. It's not an example of digastric muscle. It's an example of digastric muscle. Sorry. When I'm talking about sternocleidomastoid muscle, my dear, sternocleidomastoid is the muscle which is lying in this neck region here. This is the sternocleidomastoid muscle. Why it is called as sternocleidomastoid? Because it is attached to the sternum. Cleido means clavicle, mastoid means the temporal bone mastoid process. Actually, sternocleidomastoid muscle is having two heads of origin. So, it is having one clavicular and the other, one clavicular and other is sternal head. That means two heads of origin. So, it is not a digastric. It is not having two bellies. It is having two heads of origin. So, the odd man out here will be sternocleidomastoid muscle. Omohyoid is having two bellies. It is having superior belly and inferior belly. Now, it is having two bellies, the superior belly and inferior belly. So, definitely omohyoid is also having two bellies. Now coming to, so my dear aspirants, many of the students get confused about ligament of Treach, muscular fibers in ligament of Treach. So why this is not the right answer, I will tell you. When I am using the word ligament of Treach, it means that the ligament of Treach is connecting the junction of duodenum and jejunum with the right crux of the diaphragm, and it is made of two muscle bellies. One is skeletal muscle belly and the other is smooth muscle belly. That means this ligament of Treach is also having skeleton, muscle belly and smooth muscle belly. So, that means the correct answer will be sternocleidomastoid muscle is not an example of digastric muscle. It is not having two bellies. It is having two heads of origin, the sternal head and the clavicular head. Now, I would like to show you an image for it. So, please see this diagram. Can you see the green color structure here shown? Ligament of Treach. So, we have talked about the ligament of Treach. So, can you see here? This is the ligament of Treach. This ligament of Treach is giving support to the junction. So, if you see, this is the loop which you are seeing. So, let me just show you the loop. Yeah. So, exactly this is the loop which you are seeing. And this is the junction of duodenum and jejunum. So, from the junction of duodenum to jejunum, the muscle fibers which you are seeing is attached to the diaphragm. So, this is attached to the diaphragm. So, this belly, that is the ligament of Treach, which is supporting the duodenum jejunum junction, DJ junction, is made of two bellies. It is made of skeleton muscle belly and it is made of smooth muscle belly. So, this is also an example of digastric muscle. Let's move on to the next. Muscle with parallel fibers are all except. So, firstly, it is important that you should understand the concept of parallel fibers. So, exactly when you go for dissection, cadaveric dissection, and you see the muscle, what you can see, the appearance of the muscle fibers will tell you whether this muscle is unipinnate, whether it is shape is like a half feather, whether the shape of this muscle is like a full feather, whether the muscle is in the shape of multiple feather, then it is multipinnate, or it is having parallel strips of the muscle, whether the muscle fibers are concentrating at one point, twisted, muscle fibers are twisted or not. So, parallel muscle fibers mean the muscle fibers will be like this. Okay. So, here if I talk about the example of muscle fibers with parallel fibers are all except. So, odd man out we have to choose, and here my dear aspirant, the correct answer will be tibialis anterior, because tibialis anterior muscle fibers are circumpinnate. That means all the muscle fibers are converging to the interior, and the shape of the morphological classification of tibialis anterior is an example of circumpinnate muscle fibers. If I talk about sartorius, the talar muscle in the anterior compartment of the thigh, rectus abdominis, the six-pack muscle in the anterior aspect of the abdomen, the sternohyoid muscle in the neck region, all these are example of parallel fibers. So, the odd man out and the correct answer will be tibialis anterior. My dear aspirants, so many times questions has been asked from the example of morphological example of muscle. So, a quick revision of that. So, firstly, I want you to show that this is the tibialis anterior muscle, and this is originating from the condyle of tibia and inserting towards the base of first metacarpal medial cuneiform. So, here the muscle fibers are not exactly parallel, but all the muscle fibers, if you see the cut section, they are like circumpinnate. The muscle fibers are converging inside, they are converging inside, and the shape is to be circumpinnate. The right answer will be circumpinnate. Now, if I talk about, like, see here, so circumpennant, the shape is like this, and the best example of this is tibialis muscle, tibialis anterior muscle, just we have written here. Now, see here, this is how the shape of unipinnate, half feather is there, bipinnate, full feather, multipinnate. The best example of these muscles are, unipinnate muscles are lumbrical muscle, first and second, palmar introsei muscle. Bipinnate muscles example are lumbrical muscles, third and fourth, and dorsal introsei muscles. Multipinnate muscle fibers, best example is acromial fibers of deltoid muscle. Acromial fibers of deltoid muscle. The acromial fibers of deltoid muscle is also called as the middle fibers of deltoid muscle. So that is in the form of multiple feathers. Now see here. Now you can see here, now there was one option given sternohead. Can you appreciate the muscle fibers, my dear aspirants? You can clearly see the muscle fibers are pallar. So yes, this is an example of pallar muscle fibers. Same goes with the sartorius muscle. So one of the muscle fibers which was given in the option was sartorius muscle. So you can see here, this ribbon-like muscle, here also the muscle fibers are pallar muscle fibers, and the example will be of sartorius muscle. Also, you can see rectus abdominis muscle. If I enlarge this, this is the six-pack muscle which is lying on the anterior abdominal wall in the anterior aspect, and you can see in between we have got tendinous intersections. So we have got tendinous intersections here. This is the six-pack muscle, okay, and you can see again the fibers are, muscle fibers are parallel to each other. So this is an example. This muscle is rectus abdominis, and this is an example of parallel muscle fibers. So my dear aspirants, it's clear that by seeing this diagrams, I think it's quite clear to you that definitely the correct answer will be tibialis anterior, which muscle fibers are circumpennate, not pallar fibers. Let's, before proceeding to the next, I just have given you the few examples so that you can by heart this. Muscles with oblique fasciculi means the oblique fasciculi means muscle fibers are oblique in the direction of the pull. The muscle fibers can be pinnate. Examples of oblique fasciculi are triangular, pinnate, feather-like in construction. So these kind of arrangement of the muscle fibers make this muscle very powerful muscle, but the range is reduced in comparison to pallar muscle fibers. Okay, that means the muscle with which is having an oblique fibers, their range of movement is less in comparison to that of pallar muscle fibers. The examples are triangular, temporalis and adductor longus, unipinnate, flexor pollicis longus, extensor digitorum longus. The example which I have given is also the example of unipinnate. So the other example will be first and second lumbricals and palmar introsei. So you can just note down. Bipinnate, third and fourth lumbricals and dorsal introsei, along with it rectus femoris and flexor hallucis longus. Multipinnate, actually in some of the books they have written tibialis anterior as multipinnate, but some of the book has written it circumpennate. So both are correct, don't worry, both are correct, subscapularis and deltoid. So best example will be deltoid of multipinnate. Muscles with pallar fasciculi are those which are having a wide range of movement, and the strength is also is there, but it is less than that of oblique muscle fibers. The shape of the muscle with pallar muscle fiber having quadrilateral shape is thyroid strap muscle, which is the sartorius and sternohead, strap with tendinous intersection, which is also an example of pallar muscle fibers. Rectus abdominis. Fusiform is biceps brachii and digastric muscle. So my dear aspirants, these are the example of muscle fibers arrangement and classification according to the morphology of the muscle fibers. So do go through this. It's very important for your MCQ sessions. It's very important for your FMG examination and for the next examination, dear. Now, in the following nutrient artery to the bone, choose the wrong pair. We know that long bones get nutrition via nutrient artery. Yeah. So we know that when we are talking about the when we are talking about the blood supply, when we are talking about the arterial supply or nutrition of the long bone, it happens through the nutrient artery. So we have to choose the wrong pair. So in case of humerus, the nutrient artery is profunda brachii. It's absolutely correct. In case of radius, it is via anterior intraosseous artery. That is also correct. Fibula by peroneal, the odd man out, or which is not the correct match the following, is tibia. Actually, tibia, one of the bone of the leg, okay, it is getting, if we talk about its nutrient artery, the name is posterior tibial artery. It's not the anterior tibial artery. Tibia is the bone which is getting its nutrition from posterior tibial artery and not the anterior tibial artery. So the correct answer will be D. Got it? Now let's move on to the next. All are valveless except, all of the following are valveless except. The options are dural venous sinuses, hepatic veins, femoral veins, inferior vena cava. So which of the veins are valveless? You have to mark the right answer, whether it is A, B, C and D. So for the correct explanation of this MCQ, it is quite clear that all the veins which is mentioned here is valveless except the femoral vein. Femoral vein is having, it's a deep vein and it is having valves present in it. It contains valve. Inferior vena cava, hepatic veins and dural venous sinuses are valveless. So the odd man out is C, femoral vein. Now my dear aspirants, so this is another image based MCQ for you. So identify the muscle shown in the diagram. So first thing is that this is the lateral view of the skull. So this is the lateral view of the skull. Okay. So you have to first, in this lateral view of the skull, first you have to identify this muscle and then mark the right answer. Now coming to the options, identify the muscles shown in the image, whether the muscle fiber is cruciate example of muscle fiber, whether it is convergent, whether it is multipinnate or spiral. So this is also an MCQ of morphological classification of the muscle fiber. So I just want to enlarge this image, and what you can see, this is exactly the muscle. Okay, you can see this is the total muscle. Okay, actually this muscle is, the name of this muscle is masseter muscle, which is, this is the mandible ramus, and on the outer aspect of the ramus of the mandible here, when we are clinch your teeth, what you can see, can you feel the tightness of the quadrilateral muscle on the lateral aspect? That is the masseter muscle. And when you will see the fibers of masseter muscle, so if I'm just enlarging this, you can clearly, let me use a different color so that you can understand. So you can see the fibers of these muscles are going in this direction, and the fibers of these muscle fibers here is going in this direction. So what you can say, they are crisscrossing each other. That means the muscle fibers of masseter muscle is crisscrossing each other. They are crisscrossing each other. They are crisscrossing each other. So this becomes an example of cruciate muscle fiber. So what is the best answer for this muscle fiber? So this became an example of cruciate muscle fiber. So the correct answer will be cruciate. A is the correct answer. Identify the type of muscle shown in the image. The correct answer is cruciate. Coming to the next, let me read it for you. Which of the following joint is paired correctly with its type? Which of the following joint is paired correctly with its type? Option A, proximal and distal radioulnar joint is condyloid synovial joint. Okay. Radiocarpal joint is pivot synovial joint. Okay. Intercarpal joint is plain type of synovial joint. Metacarpophalangeal joint is hinge variety. Interphalangeal joint is condyloid synovial joint. So this MCQ is again match the following type of MCQ, and you should mark the odd man out, which is not correctly matched in this condition. Which of the following is not correctly matched with the type? So we have to see the odd man out here. Which of the following is correctly matched? Okay, that most of the options which is given to you is incorrectly matched, and you have to correctly match the joint and the type of the joint. Question number 16. My dear aspirants, when we are talking about all the options, So this is wrong. Proximal and distal radioulnar joint is not condyloid variety, it is of pivot variety. So it is wrong. Radiocarpal joint, that means radius and the carpal joint forms wrist joint and it is ellipsoid variety. So it is wrong. Intercarpal joint is plain type of synovial joint and this is the correct match the following. So C is the right answer. Metacarpophalangeal joint is not hinge variety. I told you metacarpophalangeal joint is ellipsoid variety of synovial joint. Interphalangeal joint is hinge variety and it is not condyloid joint. So this is also a wrong match the following. The correct answer is intercarpal joint. The joint formed between the carpal bone is plain variety of synovial joint. C is the correct pair and the correct answer. Same thing, it is written also here. C is the correct answer. So those who want to revise, they can revise it. Proximal and distal radioulnar joints are example of pivot variety of synovial joint. Radiocarpal joint, when I am using the word radiocarpal joint, it means wrist joint and it is an example of condyloid variety. Condyloid variety is an example of structural classification, but if I talk about functional, it is ellipsoid variety of synovial joint. Intercarpal joint is a variety of plain type of synovial. It's absolutely correct. Metacarpophalangeal joint, again they have written condyloid, that is structural classification, but functional classification will be it is ellipsoid variety of synovial joint. And as I told you, interphalangeal joint is an example of hinge variety of synovial joint. Got it? Let's move on to the next. All carpo, metacarpal and intermetacarpal joints are plain types. When we are talking about all carpo, metacarpal and the intermetacarpal joint, they are of plain variety of synovial joint except carpo, metacarpal joint of the thumb, carpo, metacarpal joint of the fifth metacarpal, carpo, metacarpal joint of the third metacarpal, intermetacarpal joint of the fourth and the fifth metacarpal, intermetacarpal joint of the first and second. So all the carpo metacarpal joint which is mentioned here or intermetacarpal joint which is mentioned here is an example of plain type of synovial joint except the odd man out. The correct answer here is, if I talk about the correct answer, it is carpo metacarpal joint of the thumb, because it is the variety of saddle type of synovial joint. It's a variety of saddle type of synovial joint. So please see the right answer. All carpo, metacarpal, intermetacarpal joints are plain type of synovial joint, but when we are talking about carpo metacarpal joint of thumb, it is an example of saddle variety of synovial joint. Now coming to the next question, question number 18. All of the following are true statement about the metaphysis of the bone except. Option A, it is the strongest part of the bone. It's the most vascular part of the bone. Growth activity is maximized here. It is the reason of favoring hematogenous spread of infection. So here the question is asking about which part of the long bone? Metaphysis. So when we are talking about metaphysis, we know that yes, it's the most vascular zone of the bone. So absolutely option statement B is correct statement about the metaphysis of the bone. Growth activity, because it is most vascular, the growth activity is maximum here and blood capillaries are twisted is in the form of hair pin bend. The blood vessels are in the form of bended like this. So what will happen? There is trapping of more infection inside. So it is favoring the hematogenous spread of infection. So only metaphysis is the reason which is involved most in the cases of osteomyelitis. So this statement is also correct. The wrong statement is it is the strongest part of the bone. This is not correct. Actually, this is the wrong statement and so it is the correct answer. The strongest part of the bone is not metaphysis, but the strongest part of the bone is diaphysis. So please note down. Please note down all of you. Strongest part of bone is diaphysis. The strongest part of the bone is diaphysis and not the metaphysis. So the correct answer for question number 18 will be A. Now coming to question number 19. Atlanto-occipital joint is of synovial variety. Atlanto-occipital joint is of synovial variety. The options provided are A. Trochoid, ellipsoid, condylar and saddle variety. Means the articulation between the occipital bone and that of atlas bone. So the first cervical bone. So the articulation between atlas and occipital bone is an example of ellipsoid variety. So definitely question number 19, the correct answer is B. Atlanto-occipital joint, the correct answer is ellipsoid variety. When we are talking of atlanto-axial joint, that is an example of median atlanto-axial joint, that is an example of pivot type of synovial joint. But the articulation between the first cervical vertebra, atlas, and that of occipital bone, the example is of ellipsoid variety of synovial joint. Let me show you this image. So you can see here AO joint. What do you mean by AO joint? AO joint means atlanto-occipital joint. And atlanto-occipital joint is an example of ellipsoid variety of synovial joint. And if I talk about AA joint, that is atlanto-axial joint. This is atlanto-axial joint, articulation between the first and second cervical vertebra. And this, if we talk about medial atlanto-axial joint, this is an example of pivot variety of synovial joint. Now, let's talk about next. Question number 20th. Bone ossified at birth. The bone which is ossified at birth. The options given here is upper end of humerus, lower end of humerus, lower end of femur, none of the above. The bone which is already ossified when, now here I want you to explain certain concepts. So there is a law of ossification is there, and there is also, it is very important for us to know that the primary ossification centers of the bone appear before birth and secondary ossification centers appears after birth. Okay. Now there is the bone which is not according to this law. What happens? And certain bones, that is the lower end of the femur and the upper end of tibia, the secondary ossification centers appears along with 9 months of intrauterine life, just before the birth. It appears just before the birth. That means the bone ossified at the birth will be, the correct answer will be the lower end of femur. Okay, so my dear aspirants, here I just want you to show this diagram where always what happens, secondary ossification centers appears at the ends of the bone, and if I talk about primary ossification centers, it is appearing in the middle part of shaft of long bone. It appears at the ends of the long bone. Now, primary ossification centers appears before birth. Primary ossification centers appears before birth, and secondary ossification centers appears after birth. The secondary ossification center which appears before will ossify later in life, and which appears later in life will ossify at a faster rate. So what happens? For example, ends of the bone is having secondary ossification center, and if at the, that means, for example, if the upper end ossification center, secondary ossification center appears at 1 year after the birth, and lower end ossification centers appear 4 years after the birth, that means lower end will fuse first in comparison to upper end. Means the secondary center which appears first will fuse later, and the secondary center which appears later will fuse first. So this is also one of the point about ossification. But it is quite clear, for the correct answer in this, it is quite clear that always secondary center appears after birth. But when we are seeing the lower end of femur, along with the birth, the secondary appears. So for lower end of femur and upper end of tibia, secondary center of ossification appears just at the end of 9 months of intrauterine life. That means, or you can say just before birth, So just before birth. So just before birth, this secondary centers appears. So the correct answer will be lower end of femur. Now, one more thing I want you to tell. So this is the law of ossification, which I told you. Now, the other thing is that now this is known to you, primary center of ossification appears before birth. For most of the bones, the primary center of ossification appears by 8th week of intrauterine life. The odd man out is clavicle. Clavicle is a bone which the primary centers appear by 5th week of intrauterine life. Most of the other long bones, if you will see, it appears by 8th week of intrauterine life. But in clavicle, primary center of ossification appears by 5th week of intrauterine life. And secondary center of ossification appears after birth. Secondary center of ossification appears after birth. If you want to know more, you can just add on, the secondary center which appears first will ossify later, and the secondary center which appears later will ossify first. So in case of secondary ossification center, you just remember one more important point. In case of secondary center of ossification which is appearing after birth, center which appear first ossifies later, and the center of ossification which appears later ossifies first. Okay, that means the secondary center of ossification. For example, if this is an example of a long bone, this is a long bone, so it is having an upper end and lower end. If upper end is having secondary center appearing first year, and the lower end is having secondary center appearing at 4th year, the first year will ossify later, but the 4th year will ossify first. So this is also the second part of this secondary ossification center. Now, one more thing you can see here, the long bones, for example, this is an example of humerus bone. You can see in the middle or in the shaft region or a diaphysis, you can see these small dots which is seen. Actually, these are foramens. These are which foramen? These are nutrient foramens. And these nutrient foramens through which the nutrient artery traverses for giving arterial supply and nutrition to the long bones. The direction of nutrient foramen, just opposite to the direction of nutrient foramen, is the growing end of the bone. It's very important for you to know that it's a very important point. Please by heart is that the growing end of the bone is always opposite to the direction of nutrient foramen. Okay, so just add on. Growing end of bone growing end of long bone is opposite to direction of nutrient foramen. Okay, this is also very important, that the growing end of any long bone will be always opposite to the direction of nutrient foramen, where the nutrient artery is going. Now, my dear, for this, I am just showing you this image. This image, you can see there is one girl just closing her hand and praying, and what you can see, why I have used this image, because the yellow color lines has been shown to you. The arrow mark of this yellow color line is showing the direction of nutrient foramen. So this image is showing you direction of nutrient foramen. And my dear aspirants, opposite to the direction of nutrient foramen is the growing end. So for example, in case of upper limb, and this is the case of lower limb. Okay, so what you can see, in case of lower limb, the direction of nutrient foramen is going towards the foot region, and direction of nutrient foramen is going towards the hip region. So just opposite to it will be the growing end of the bone. That means lower end of the femur and upper end of tibia will be the growing end. Same way, if you will see in a case of joint, for example, if you will see the upper limb, you can see the direction of the arrow is towards the elbow. So towards the elbow and away from the knee. Away from the knee is the direction of Newton foramen. That means the growing end of the upper limb will be towards shoulder joint and towards the wrist in the upper limb. So just remember the direction of arrow, that is demarcating the direction of Newton foramen, and opposite to the direction of Newton foramen is the growing end of bones. So let's move on to the next question. With respect to the basic anatomy of bone, all of the following statements are true except. Okay, the options are: diaphysis is derived from primary ossification center, compact bone is present in diaphysis of long bone, cancellous bone is present in epiphysis of long bone, Haverian system is absent in compact bone. So my dear aspirants, so that means we have to know the basic anatomy of the bone and we have to mark which is the incorrect statement. So when we are talking about diaphysis, yes, we know that diaphysis of the bone is present in the shaft region of the bone. So definitely the diaphysis is derived from primary ossification center. Now, compact bone is present in diaphysis of long bone. Cancellous bone is present in epiphysis of the long bone. So, compact bone we know, yes, in the center or the shaft region we have got the compact bone. Cancellous bone is present at the ends, that is epiphysis of the long bone. That means A, B, C, all these three statements are true statements about the anatomy of the bones, but the odd man out is D. Haverian system is absent in compact. If you remember, one of the histological image I have shown you, and I have told you Haverian system is also called as osteon. The other name of Haverian system is osteon. The other name of Haverian system is osteon. And in the center of Haverian system, there is Haverian canal, and around it there is concentric laminas, circular concentric laminas, in which the bone osteophyte cells reside in lacunae spaces. So Haverian system is the key feature for identification of compact bone. So it is not absent in compact bone. It will be definitely present in compact bone. So that means it will be definitely present in compact bone. So D, the Haverian system is absent in compact bone is not the untrue statement, is not the correct statement. So the correct answer is D. Now see here. The ends of the bone is called as epiphysis. Diaphysis is the shaft, and we know that primary ossification centers appear in the shaft of the long bones, and in the epiphysis region secondary ossification centers appear. Secondary ossification centers appears. Okay. Now, if we, so again I am showing you this image in which you can understand the compact bone microscopic structures and histological part. So if you will see the compact bone, so this is showing you the transverse section, cut section of a compact bone, in which you can appreciate that in the center we have got an Haverian canal. So this is a Haverian canal, this is another Haverian canal, this is a Haverian canal, and these are Haverian canals which is connected by Volkmann's canal, VC for Volkmann canal, and these are surrounded by concentric laminas, in which we have got, in this concentric laminas we have got lacunae, you can see, and this lacunae is communicating. In the lacunae we have got osteocytes. So you can see these are the osteocytes. The mature osteoblast or the cells of bone cells are called osteocyte, which forms communication with each other through canalicules, and this whole concentric structure, this whole unit is called as osteon. That means Haverian canal in the center, surrounded by osteocytes in the circular laminae, concentric laminae residing in the lacuna space. This whole unit is called as Haverian system. The other name of Haverian system is osteon, and osteon is the characteristic feature of compact bone. So it is definitely present in compact bone. It is not absent. I would like to show you an enlarged view. So all of you just see this. So I am showing you an enlarged view of compact bone, and here if you will see in the center, so let me just use another color. Can you see this? This is HC. What do you mean by HC? Haverian canal. What is this? This is Haverian canal. Now talking about the concentric lamina. So these is concentric lamina. So you can see the concentric laminas which is surrounding this Haverian canal, and in that you can see these spaces are there. So just can you see these are the spaces which is lying there. So many spaces are in the concentric lamina. What is this spaces? These spaces are called as lacunae, and in this lacunae what resides? In this lacunae the structure which is residing is, the structure which is residing in this lacunae are osteocytes. These are osteocytes. Okay. Now, so that means if I am talking about this whole unit is given the term osteon. So this whole is called as an osteon. This whole unit is called as osteon, and this whole unit is called as an osteon, and the other name of osteon is Haverian system. The other name of this is Haverian system. So please note down, osteon is also called as Haverian system containing Haverian canal in the center, and this is the characteristic feature of the compact bone. This is the characteristic feature for the compact bone. Okay. Now let's talk about question number 22. Okay, let's talk about question number 20. Let me read it for you. Parasympathetic fibers stimulate secretion by all the glands except, the options given are sweat gland, lacrimal gland, salivary gland, nasal gland, palatine gland. Okay. So parasympathetic secretion is stimulating all the glands except. You have to find the odd man out. So my dear aspirants, here lacrimal, I talk about lacrimal, salivary, nasal, palatine gland, all these are parasympathetically stimulated, and the secretion is via parasympathetic stimulation. The odd man out is the sweat gland, because sweat gland is sympathetically stimulated. So the correct answer will be sweat gland. Sweat gland secretion is sympathetically stimulated. With exception to the sweat gland, glandular secretions, most of the glands is having the secretion parasympathetically stimulated. The correct answer will be sweat gland, because its secretion is sympathetically stimulated. Got it? Now let's move on to the next. Reticular fibers of collagen tissue is present in all except. Reticular fibers of collagen tissue is present in all except. The option is A, thymus, B, bone marrow, C, spleen, and D, lymph node. When I am talking about reticular fibers, it is actually very important for the structural support. It is giving structural support to the lymphoid structures. The odd man out here is thymus, because in case of thymus gland, there is no reticular fibers. The thymus gland is containing. So what does the thymus gland contains? Thymus gland is having epithelio reticular cells. So the structural or the main cells which is giving the structural support in case of thymus gland is epithelio-reticular cells in place of reticular fibers. Other than that, bone marrow, spleen, lymph node, all is having reticular fibers as a connective tissue framework, forming structural framework for this lymphoid structures. Now, vasa vasorum. I think this is easy for you because related to this MCQ, one MCQ I have already solved in the previous session. Vasa vasorum. The correct definition of vasa vasorum is whether it is small blood vessels supplying the walls of large blood vessel, whether small blood vessels supplying the nerves, whether the veins is accompanying the arteries, whether the veins is accompanying the nerves. If I have to choose the right answer, vasa vasorum, the correct definition of vasa vasorum are small blood vessels supplying the walls of large blood vessels. That means in case of large arteries, elastic arteries, in case of great veins, in the outermost layer, we have got small vessels, we have got small blood vessels which is giving nutrition, and small blood vessels supplying large blood vessel wall is the definition for vasa vasorum. Here is the image which is showing you. So here we can see the outermost, this is the tunica adventitia layer. We know that tunica adventitia is the outermost layer. So yes, here this is TM, that is tunica media, this is TA, that is tunica adventitia, and in the outermost layer you can clearly see the small blood vessels has been shown. This is small blood vessel, this is small blood vessel. These are vasa vasorum which is giving nutrition to the outermost layer of the large arteries or large vein. Let's talk about the next MCQ. Panniculus adiposus is seen in scrotum, it is seen in orbit, it is seen in eyelid, or it is seen in penis. Panniculus adiposus. So we have to mark the right answer. Actually, there are certain structures in our body where there is no fat. What do you mean by panniculus adiposus? Panniculus adiposus means subcutaneous fat. So the fat is absent in certain cases. So please write down that list and we will be able to mark the right answer. Here the correct answer is panniculus adiposus is seen in case of, the correct answer is orbit. The correct answer is orbit. Yes, in the orbit we have got panniculus adiposus present, but the scrotum, eyelid and penis is having no fat. So please write down panniculus adiposus is absent in following areas. So it is not present in eyelid, it is not present in penis, it is not present in scrotum, it is not present in nipple, it is not present in areola region. So it is that means there is no fat in the nipple and areola region of the mammary gland, scrotum, penis and eyelid. Orbit is definitely containing fat, panniculus adiposus. So that is the right answer. Actually, when I am talking about another term is there, that is called as panniculus carnosus. When I am using the word panniculus carnosus, for example, generally the muscles are present and is covered by deep fascia. Okay, the muscle is having deep fascia covering, but and we know that muscle is covered by deep fascia. But in certain cases, the muscle is present in superficial fascia. That becomes an example of panniculus carnosus. So, certain muscles like muscles of the face, platysma, dartos muscle, palmaris brevis, these are the example of muscles which is residing in the superficial layer, and they are example of panniculus carnosus. So, please write down that also, example of panniculus carnosus muscle. Example of panniculus carnosus muscle. So, my dear aspirants, panniculus carnosus muscle, all the muscles of face. So, in the face, we have got many muscles. We have got zygomaticus major, minor, levator anguli oris, orbicularis oris, orbicularis oculi, depressor labile, alachnese, rhizorius. So, many muscles are there, mentalis. All these muscles which is residing in the face are present in superficial fascia, not covered by deep fascia. So, definitely all the muscles of the face are example of panniculus carnosus. Other example is neck area muscle, platysma muscle. One of the muscle in the scrotum, that is dartos muscle. Another muscle of the hand, in the medial side of the hand, in the skin of this area and the medial side of the hypothenar region on this area, we have got palmaris brevis muscle. This palmaris brevis muscle is also an example of panniculus carnosus muscle, which is the muscle residing in the superficial fascia. Done. Now let's move on to the next. So we have done with this. Now let's move on to the next MCQ, question number 26. Ligamentum flavum have which type of fibers? So which is the most important fibers residing in ligamentum flavum? Whether the fiber is type 1 collagen fibers, whether the fiber is type 2 collagen fibers, whether the fibers is reticular fibers, or whether the fiber is elastin fibers. Ligamentum flavum, which type of fibers are present? We have got 4 options and you have to mark the right answer. Type 1 collagen fibers, type 2 collagen fibers, reticular or elastin. Ligamentum flavum contains which type? The maximum number. So actually ligamentum flavum is providing elasticity to the adjacent lamina of the vertebrae and it is having elastin fiber. So the major component of ligamentum flavum means it is having elastin fiber. So definitely the correct answer will be elastin. So just see here, you can see this is the ligamentum flavum which is shown here. This is ligamentum flavum and the ligamentum flavum is connecting the adjacent area of the lamina of the vertebrae and it is containing more of elastin fibers. Now, primary curvature of spine are present in which of the following areas? So primary curvatures of the spine. So it's important to know. So we know that in the vertebral column we have got primary curvatures, and after the birth, due to neck holding and due to when the person is standing, the baby starts walking and standing on legs, there is other support. So it's important to know which is an example of primary curvature and which is an example of secondary curvature. The option given is thoracic, cervical and lumbar, and you have to mark the right answer. Primary curvature. So primary curvature of spine is present in. Please mark the right answer, and the correct answer is thoracic. Thoracic region is having primary curvature of spine. For that, I would like to show you this image. So you can see the entire vertebral column here. So what you can see is cervical curvature is here, which is having convex forward. It is forward having convexity. Same way you can see the lumbar curvature is also convex in forward direction. So both of these are convex in forward direction. Actually, when the baby start the function of neck holding by 3 to 4 months of age, the secondary curvature is found in the cervical region. Same way, when the baby stands on the leg and support their weight, by 1 year, the baby is having the lumbar curvature formed with the convexity forward in the lumbar region. The thoracic and the sacral both are maintaining primary curvatures. With maintaining primary curvatures, which is having the convexity is in the backward direction and it is concave in the forward direction. It is concave in the forward direction. So primary curvature, sacral and thoracic curvature will be the right answer, and here the primary curvature, only thoracic was given, so definitely thoracic is the right answer. The cervical and lumbar both is having secondary curvatures. Both are having secondary curvatures. So these curvatures are formed after birth, but thoracic and that of the sacral curvatures are formed before birth only, and they are maintained after birth also. Now let's talk about question number 28. All of the following are example of ball and socket type of joint except. All of the following are example of ball and socket type of joint except. The options are talocalcaneo-navicular joint, malleus and incus joint in the middle ear, hip joint, incus and stapes joints in the middle ear. All are example of ball and socket type of joint except. So we have got 4 options. The articulation between talocalcaneo-navicular. So you have to find out the odd man out. So we know that shoulder joint, we know that there is a shoulder joint, we know that there is a hip joint. All these joints are example of ball and socket joint, but we have got certain other joint which is also an example of ball and socket joint. So we have to mark the odd man out and we have to see the correct answer. So here the correct answer will be malleus and incus joint of the middle ear. Actually, malleus and incus articulation in the middle ear is an example of saddle variety of synovial joint. It's an example of saddle variety of synovial. Rest, talocalcaneo-navicular joint, the articulation between the talus, the calcaneum and navicular bone is an example of roughly ball and socket type of synovial joint. Hip joint definitely is an example of ball and socket type of synovial joint. Incus and stapes is also an example of ball and socket type of synovial joint. But malleus and incus articulation is an example of saddle variety of synovial joint. Got it? Now, see here. Here you see this talocalcaneo-navicular joint. So here in this diagram, you can see here the articulation is seen with the 3 bones. So this bone which you are seeing is the talus bone. Here you can see the navicular bone, and this is the anterior part of calcaneum bone. So this is the anterior part of the calcaneum bone. So the articulation between these 3 bones, this is the talocalcaneo-navicular joint, and this articulation, as you can see in the diagram, is ball and socket type of synovial joint. Now other than that, Inquido-malleolar joint. So we have got two arteries. One is inquido-stapedial joint. So we know that in the ear we have got three ear ossicles: malleus, incus, and stapes. Stapes is the smallest bone of the body, and the articulation between malleus and incus, which is called as inquido-malleolar joint, is an example of saddle variety of synovial joint. And if I talk about incus and stapes, the articulation between incus and stapes is an example of ball and socket type of synovial joint. Now let's talk about the next MCQ. Which artery is evaluated during physical examination of peripheral vascular, physical examination of the peripheral and vascular system? The options are lateral plantar artery, dorsalis pedis artery, popliteal artery, fibular and posterior tibial artery. So among this, the most important artery to be evaluated for the physical examination of peripheral vascular system, the most correct answer is the artery on the dorsum of the foot, that is dorsalis pedis artery. Dorsalis pedis artery. This is the right answer. The artery being evaluated during physical examination is dorsalis pedis artery. Now, I can show you this image where you can see the tendons of extensor hallucis longus and tibialis anterior. Between that, the artery being palpated and pressed against the tarsal bones, most commonly tarsal bones, and which is palpated in between these two tendons of muscle is the dorsalis pedis artery. Most commonly, this is palpated for the peripheral vascular disease. The pulsation of dorsalis pedis artery is palpated. Now, true statement, osteoblasts give rise to osteocytes, growth of bone occurs at diaphysis, epiphysis is present between metaphysis and diaphysis, interphalangeal joint is a saddle variety of joint. So, we have to note down the true statement here. So, the true statement is osteoblast, which is immature bone cells which get matured and which is having ground substance and matrix, and it forms the mature osteocytes. So osteoblast is giving rise to osteocytes is absolutely correct answer. Growth of bones is not occurring at diaphysis, but it is occurring at the epiphyseal and epiphyseal growth plate. It is occurring at the epiphyseal growth plate. Epiphysis is present between metaphysis and diaphysis is absolutely wrong. We know that metaphysis is present between epiphysis and diaphysis. Interphalangeal joint is not a saddle joint. Interphalangeal joint is a hinge variety of synovial joint. Now see here. Here in this diagram you can see I have shown you the section of the bone where you can see the epiphysis at the ends of the bone. We can see the epiphysis at the ends of the bone, and in between is the diaphysis here. And epiphysis is the area where secondary ossification centers appear and it leads to the growth of the bone, and diaphysis is the area where primary ossification centers appear before birth. And in between the epiphysis and diaphysis we will have the metaphysis. Now before ending this whole MCQs related to the general anatomy, a wide description has been done. I would like to tell you about sesamoid bone. Actually, few examples of sesamoid bone must be known to you. First thing is that sesamoid bones are not true bones. These are the bones which is appearing in the tendons of muscles. So, the largest sesamoid bone in our body is patella. So, here you can see the quadriceps femoris muscle. We know that quadriceps femoris muscle is the muscle of anterior compartment of the thigh, which is formed by four muscles, that is vastus medialis, vastus lateralis, rectus femoris, and we have got vastus intermedius. So, in the tendon of quadriceps femoris muscle, the sesamoid bone which is formed is the patella. So, patella is the largest sesamoid bone. It appears in the tendon of quadriceps femoris muscle. Now, I would also like to show you the fabula, the small sesamoid bone. Can you see the small sesamoid bone? It is shown on the posterior aspect of the knee joint. It is formed in the lateral head of gastrocnemius muscle. So fabula bone is another example of sesamoid bone. Fabula bone, which is seen on the posterior aspect of knee joint, it is formed in the lateral head of gastrocnemius muscle. Now, other examples of sesamoid bones are the, so we know that lenticular process. Can you see the lenticular process of incus bone? So actually the lenticular process of incus bone, lenticular process of incus bone, this is also an example of sesamoid bone, which is also at certain bones regarded as the fourth ossicle. Other example, this is the pisiform bone. Pisiform bone, the smallest carpal bone, is the example of sesamoid bone, which is formed in the tendon of flexor carpi ulnaris muscle. Now, other than that, we have got sesamoid bone also present in the tendon of fibularis longus. We have also got in the abductor hallucis, we have got the sesamoid bone. So, also abductor hallucis muscle of the foot is having sesamoid bone. Peroneus longus muscle tendon is also having sesamoid bone. Now, these are this image which you are seeing is showing you the sesamoid bone which is present in the other bones of the hand. So, we can see at the first, so the most common site of sesamoid bone, as you can see, is the metacarpophalangeal joint. The first metacarpophalangeal joint contains 99 to 100% sesamoid bone. The other joints where it can be present at metacarpophalangeal joint for the other fingers. It can also be present in interphalangeal joints. So, these examples which I have given you, for example, the largest sesamoid bone, that is the patella bone, and this sesamoid bone is having no perosteum attachment. It is formed in they are having no perosteum covering like the original, like that of the original that of the original bone. So it is having no perosteum covering. Other than that, if I talk about the other bones, we can see that it is also present when we are talking about the other site. It can be present in the fabula bone. It can be present in the other site, like it can be present in the other site is lenticular process of the incus bone. It can be present in the pisiform bone in the tendon of flexor carpi ulnaris. So, here we have finished the general anatomy, and now I would like to start with the other, upper limb and the thorax. That will be highly beneficial for you. So, I just want everybody to please note down that will be highly beneficial. Okay. So, let me just connect to the other upper limb. Okay. So, in upper limb category, important topics, actually nerves and brachial plexus and few important arteries and spaces are very important. So, I want everybody to have a detailed knowledge of upper limb, because that is very, very important for you to note down. So, that is very, very important. So, let's talk about the upper limb. So, the first thing which I want everybody to note down in the session of upper limb is that the axillary region. It's important that you should understand where is the axilla exactly. So, if I talk about upper limb, for example, I have covered up the general anatomy whole part. When I am talking about upper limb, nerves are very, very important topic of upper limb. Brachial plexus are very important. Axillary artery is important. Subscapular spaces are important. Axillary lymph node and all are important. So, it's important that you should have a detailed anatomy of this. So, I would firstly like to tell you about the walls of axilla, the content of the axilla. And then I would like to give you a brief description of brachial plexus and the three nerves and few important nerves in slide briefly I will explain, along with the clinical MCQs related to that topic. That means ulnar nerve, median nerve, radial nerve, axillary nerve. All this will be explained along with an MCQs related to the topic. So, let's start with this. When I am talking about the axilla, axilla is a four-sided pyramidal region which is located in the armpit. Okay, it is having four walls. It is having an apex which is directed upwards. It is having a base. So, you can clearly see if I just enlarge this image. This is exactly showing you the area of the air. So, here we have got anterior. So, we have got an anterior and the posterior wall. So, if you just see this image, So what you can appreciate that this is the apex. We have got anterior wall and posterior wall, lateral wall and medial wall, and here just opposite to the apex we have got the base. So that means we have to know all the structures which is forming these walls of the axilla. In simple term, axilla means the region of armpit. Now let me just enlarge this. So when I am enlarging this, anteriorly if you will see, we have got pectoralis minor muscle. Actually pectoralis minor muscle is covered by pectoralis major muscle. So here we have got a small muscle subclavius. So these muscles, the whole of the chest anteriorly is having pectoralis major muscle. When you dissect and cut out, which has been done in this case, inside pectoralis major we have got, when we dissect and take out the flap of pectoralis major muscle, we have got pectoralis minor. Just below the clavicle we have got subclavius muscle. So these muscles together, so that means anterior wall is formed by pectoralis major muscle, pectoralis minor muscle, and that of subclavius muscle. So these three muscles is forming the anterior wall of axilla. Posteriorly we have got subscapularis, teres major, and that of latissimus dorsi. So actually, to be more precise, this muscle which you are seeing is forming the posterior. This is forming the posterior wall of axilla. This is formed by subscapularis, teres major, and that of latissimus dorsi. The muscles of biceps, that is biceps and coracobrachialis, these all structure is forming lateral. And here we have got M for the medial wall. So medial wall of the axilla is formed by serratus anterior. If I talk about the apex, it is going into the cervico-axillary region. It is bounded anteriorly by the clavicle, and it is bounded posteriorly by the scapula, and also it is having the first rib there. So in other words, apex is directed in upward direction. It is also called as cervico-axillary canal, and base is formed by the axillary dome or axillary fascia. So we have written the anterior wall. Please do note down. If I talk about boundaries, anterior wall you have written, posterior wall is formed by subscapularis muscle, teres major muscle, and latissimus dorsi muscle. If I talk about medial wall, the medial wall of axilla is formed by serratus anterior muscle, and the lateral wall is formed by biceps brachii and that of coracobrachialis muscle. Biceps brachii and that of coracobrachialis muscle. So these are all about the boundaries, and as we know, apex is directed in upward direction and the base will form by the axillary fascia. The other important point is to know the content of the axilla. What all structures are lying inside the axilla? The content is very important. When I am talking about the content of the axilla are following. It contains axillary fat, it contains axillary lymph node, it contains axillary artery, it contains axillary vein, it contains cords of brachial plexus, Other than that, it contains intercostobrachial nerve, it contains long thoracic nerve. So these are the important contents of the axilla. Now, so this is a transverse section of the axilla where you can see the important contents, and the walls are also defined. So when you see this section, when you see this transverse section of the axilla, you can admire the walls. So what you can see here, pectoralis minor, major, all these muscles are forming A for anterior wall. The coracobrachialis and biceps brachii, all these are forming the lateral wall. The teres major, latissimus dorsi and subscapularis is forming the posterior wall of axilla. The serratus anterior muscle is forming the medial wall. The content is axillary vein, axillary artery, cords of brachial plexus and long thoracic nerve, the major content. Other than that, intercostobrachial nerve, the cutaneous branch from the second intercostal nerve, is also the content of the axilla. Along with it, axillary lymph node and axillary fat is also the content of axilla. Now, one of the important content which I want everybody to understand is the axillary artery. So, when I am talking about axillary artery, you can see in this image, let me slightly enlarge it. This is the first rib. What is this? This is the first rib. So, beyond the level of the first rib, this is subclavian artery. The subclavian artery beyond the level of first rib is called as axillary artery. So, that means the continuation of subclavian artery beyond the level or the outer border of the first rib, it changes its name to axillary artery. Now, here you can see in this diagram, there is a key muscle here. So, can you see this muscle? So, this is the key muscle. This is the pectoralis minor muscle. So, this is coracoid process and this is pectoralis minor muscle. This is pectoralis minor muscle. So, this pectoralis minor muscle is dividing the axillary artery into three parts. It is dividing the axillary artery into three parts. This is the first part of axillary artery, which is beyond the level of pectoralis, which is above the level of pectoralis minor till the level of first rib. Behind the, so second, what I have written here, second. So, please see this. This I have written second. So, this is the second part of axillary artery, which is lying behind pectoralis minor muscle, and this is teres major muscle, and till the lower border of teres major muscle, this part which you are seeing is the third part of axillary artery. So, beyond pectoralis minor and till the level of teres major muscle, we have got the third part of axillary artery. Why it is important that we should divide the axillary artery in three parts? Because we have to know the branches of axillary artery in terms of first part, second part and third part. So, if I want to tell about the extent of axillary artery, starting from the outer border of the first rib and ending at the lower border of teres major muscle. Beyond the level of teres major muscle, axillary artery changes its name to brachial artery. So, please write down the details about axillary artery. Axillary artery is continuation of subclavian artery beyond the level of first rib outer border. Now, extent of axillary artery. It extends from outer border of first rib to lower border of teres major muscle, to lower border of teres major muscle. This is the whole extent of axillary artery, starting from the outer border of first rib till the lower border of teres major muscle. Now, it's also important to know the branches and parts of axillary artery. So, let me explain via this image and then I will show you. So, see here. Here in this diagram, very nicely you can appreciate, yes, this is the first rib. What I told you. So, from the level of first rib, so it was subclavian artery, but after the first rib or outer border of first rib, it becomes axillary artery. So, this is the first part of axillary artery, this is the second part and this is the third part of axillary artery. First part of axillary artery, if I talk about the first part of axillary artery, it is from the level of outer border of first rib till the level of pectoralis minor muscle. Second part of axillary artery is lying behind the pectoralis minor muscle and beyond the level of pectoralis minor or distal to pectoralis minor till the level of lower border of teres major is the third part of axillary artery. Beyond that, axillary artery becomes brachial artery. Now, from the first part, there is one branch, superior thoracic artery. From the second part, there is two branches, thoracoacromial and lateral thoracic artery. The thoracoacromial artery give four sprouting branches in four directions, deltoid, acromial, clavicular and that of pectoral. The third branch is giving 3 branches, posterior and anterior circumflex humeral artery and the subscapular artery. Subscapular artery further divides into circumflex scapular and dorsal, thoracodorsal artery. Thoracodorsal artery. I want everybody to please write the details of the branches of axillary artery because it's very important for you to know this. So, axillary artery branches. First part, branches of the first part of axillary artery. Lying above the pectoralis minor muscle. So, what is the location? It is lying above the level of pectoralis minor muscle is the first part of axillary artery and it gives just one branch. What is the name? Superior or supreme thoracic artery. The name is superior or supreme thoracic artery. Now, talking about the second part. When I talk about the second part of axillary artery, it is located posterior to pectoralis minor muscle. It is located posterior to pectoralis minor muscle and it is giving 2 branches. So, second and third branches I am writing in continuation because total direct 6 branches are given by the axillary artery. So, it is giving 2 branches and they are lateral thoracic artery, thoracoacromial artery. Now, my dear aspirants, I told you this thoracoacromial artery is further sprouting like a flower in 4 direction, giving deltoid, clavicular, acromial and pectoral branches. So, that is what I have shown you. This sprouting, can you see this sprouting like a flower in 4 direction? These 4 branches are the 4 sub branches of thoracoacromial artery. So, if you want to note down, you can just note down. Thoracoacromial artery is further giving 4 small branches. They are pectoral in pectoral direction, acromial towards the acromial process of the scapula, clavicular in the clavicular direction and deltoid. These are 4 sub branches of thoracoacromial artery. Now, coming to the third part of the axillary artery. The third part of axillary artery is beyond or distal to the level of distal to pectoralis minor muscle. Distal to pectoralis minor muscle till teres major muscle lower border. Thereafter, it changes its name to brachial artery. It gives 3 branches. So, 4, 5 and 6. It gives anterior circumflex humeral artery, posterior circumflex humeral artery. It gives anterior circumflex humeral artery. It gives posterior circumflex humeral artery. And it gives subscapular artery. This subscapular artery is the largest branch of axillary artery and it further gives branches. It gives circumflex scapular artery and it gives thoracodorsal artery. So, the subscapular artery, which is the largest branch, of axillary artery will further gives 2 sub branches, circumflex scapular and thoracodorsal. So, in short, we have done with all the branches of axillary artery. We have gone through the details of all the branches of axillary artery. Now, I would also like to tell you about the axillary lymph nodes. Okay. So, let's talk about the axillary lymph node, which is important for you to understand. Okay, when I talk about axillary lymph node, it is important to understand its location. So, lymph node is exactly located along with the veins. Okay. So, when I am talking, actually the pectoral means, the other name of pectoral lymph node is anterior. The posterior means subscapular, the lateral, the central and apical. Apical is the terminal group of axillary lymph node. So, firstly, I would like to describe. So, here is another image where you can see the veins. So, firstly, I want you to describe the location of axillary lymph node. So, for that, I would like to draw 2 veins. So for this, I just want to draw two veins. Okay. So here you can see so we have got 5 groups of axillary lymph node. Okay. One is the anterior group, the other is the posterior group, the third is the lateral group, then we have got the central group, and the terminal group is the apical group. Okay. Now, if I talk about the anterior group, it is located along lateral thoracic vein. Which vein is this? This is lateral thoracic vein, and this is subscapular vein. So the subscapular vein. So the anterior group of axillary lymph node. If I talk about the anterior group of axillary lymph node, it is located along lateral thoracic vein. If I talk about the posterior group of axillary lymph node, it is located along the subscapular vein. Anterior group of axillary lymph node is draining lymphatics from the anterior aspect of the body above the level of umbilicus, and major area of the breast lymphatic drainage occurs in the anterior group of axillary lymph node, except the area of axillary tail of sphinx, because the lymphatics from axillary tail of sphinx is drained into the posterior group of axillary lymph node. Anterior group of axillary lymph node is also called as pectoral group of axillary lymph node, and posterior group of axillary lymph node is also called as the subscapular group of axillary lymph node, because anterior group is located along the lateral thoracic vein. The subscapular or posterior group of axillary lymph node is arranged along the subscapular vein. Then comes the central. You can see central is located in between anterior and the posterior group. And if we talk about the lateral one, the lateral is exactly located along the axillary vein. The lateral is draining entire the upper limb, and all these lateral, anterior and posterior will again drain into central group, and ultimately they will drain into the apical group, that is the terminal group of axillary lymph node, which is lying above the level of pectoralis minor muscle. So this is the 5 group of axillary lymph nodes. So just in brief, please write down axillary lymph node. The axillary lymph node is divided into apical group, which is also called as the terminal group of axillary lymph node. Then we have the central group, which is enlarged. When this is enlarged in cases of breast cancer and all, when this central group of axillary lymph node enlarges, it compresses the lymph nodes, and ultimately the central group of lymph nodes can lead to compression of intercostobrachial nerve. Intercostobrachial nerve, which is very important because it communicates with medial cutaneous nerve of arm. Actually, when you go to the ward and you meet with a patient of breast cancer, they will tell you, बहुत pain hai, there is a severe pain in the medial aspect of arm, and the person is suffering from the breast cancer. The reason is their central group of lymph node is involved. Axillary central group of lymph node is enlarged, and they are compressing intercostobrachial nerve, which forms communication with medial cutaneous nerve of arm. So the pain is in the medial side of arm. The lateral group of axillary lymph node will drain lymphatics from the upper limb. Whole of upper limb lymphatics will drain into lateral group of axillary lymph node. So this is the drainage area. When I am talking about anterior and posterior group, the fourth is, so we have written, so I am going in this will be fourth, this is fifth, fourth, third, this will be second and one. Second and one. So let's talk about firstly posterior group of axillary lymph node. The posterior group of axillary lymph node will drain the lymphatics from back above the level of umbilicus. So whole of the back area above the level of umbilicus, and also it drains lymphatics from axillary tail of sphinx, the outer quadrant, elongation of the outer quadrant of the breast. Anterior group of axillary lymph node will drain lymphatics from front of chest and abdomen above the level of umbilicus. Okay, above the level of umbilicus and major area of the breast, and major area of the breast. And we know major area of mammary gland and breast drains into the anterior group of axillary lymph node except axillary tail of spines. Posterior group of axillary lymph node is also called as subscapular lymph node, and anterior group is also called as pectoral group of lymph nodes. So done with this, now let's move to the next topic. Okay. I would like to explain the scapular anastomosis. A very important question for your examination is scapular anastomosis. So, scapular anastomosis takes place on the scapular bone at two regions, at the body of scapula and the acromial process. The scapular anastomosis, the source of anastomosis which is formed is mainly between the branches of first part of subclavian artery, between the branches of first part of subclavian artery and branches of third part of axillary artery. So this is the major source of anastomosis. So the sub branches from the first part of subclavian artery and the branches from the third part of axillary artery, which will form an anastomotic network along the scapular region, or this body of scapula and that of acromial process of the scapula. It takes place at two regions. So firstly, let me explain and then I will write the sources. Scapular anastomosis. Let me just enlarge this image. So yes, if I am enlarging this, you can nicely see when I take at the body of scapula, you can see this is the subclavian artery. A branch from the subclavian artery, the first from the subclavian artery gives a branch that is called as thyrocervical trunk, and from the thyrocervical trunk, suprascapular artery is given. So this suprascapular artery is a branch from first part of subclavian artery. Why? Because thyrocervical trunk is also a branch from the first part of subclavian artery. Now, this anastomoses with circumflex scapular artery, and we know that circumflex scapular artery is a branch of subscapular artery, and subscapular artery is a branch of third part of axillary artery. So, this is the anastomosis which is taking place around the body of scapula between the circumflex scapular and that of suprascapular artery. Suprascapular artery is a branch of thyrocervical trunk, which is again the branch of first part of subclavian artery. Circumflex scapular is a branch of subscapular artery, which is a branch of third part of axillary artery. Around the acromial part, acromial branches of posterior circumflex humeral artery, which is a branch of third part, and acromial branches of suprascapular, along with acromial branches of thoracoacromial artery, also forms the anastomotic network. So please write down scapular anastomosis. Scapular anastomosis takes place at two regions. One is the body of scapula. One location is body of scapula. At the body of scapula, the anastomosis is between suprascapular artery. Suprascapular artery anastomosis with, this forms an anastomosis with circumflex scapular artery. And circumflex scapular artery is a branch of subscapular artery, and subscapular artery is a branch of third part of axillary artery. Suprascapular artery is a branch of thyrocervical trunk, and thyrocervical trunk is a branch of first part of subclavian artery. So, got the source. So, it is clear that two arteries are forming anastomosis. Here, two arteries are forming anastomosis. One is suprascapular artery along with circumflex scapular artery. Okay. It also take contribution from transverse cervical artery. Again, the source is from the first part of subclavian artery. The major chunk of anastomosis is between suprascapular and circumflex scapular. Here, suprascapular artery is a branch of first part of subclavian artery because it's a branch of thyrocervical trunk, and thyrocervical trunk is a branch of first part of subclavian artery. Circumflex scapular is a branch of subscapular artery, which is a branch of third part of axillary artery. Now, coming to the second location, that is acromial process of scapula. So, at the level of acromial process of scapula, the anastomosis is taking place between three arteries. So, the anastomosis is taking place between acromial branch of, it is taking place between acromial branch of posterior circumflex humeral artery, acromial branch of suprascapular artery, and acromial branch of thoracoacromial artery. So, acromial branch of posterior circumflex humeral artery, the source will be third part of axillary artery. Suprascapular is the branch of first part of subclavian artery, and slight contribution is also taken from acromial branch of second part of axillary artery. So, this is the anastomosis which is taking place at the acromial process of the scapula. Now, my dear aspirants, I would also like to show you this image where you can appreciate the branches of brachial and profunda brachii artery, because MCQ has been also asked from this topic. So, what are the branches of brachial artery and what name the branches of profunda brachii artery? We know that at the lower border of teres major muscle, the brachial artery changes the axillary artery changes its name to brachial artery. So, it gives following important branches: profunda brachii artery. Sometimes brachial artery also give branches to the nutrient artery to the humerus. It gives muscular branches. Two terminal branches are radial and ulnar artery, and it gives superior and inferior ulnar collateral arteries. Ulnar collateral arteries. So, please write down branches of brachial artery. Branches of brachial artery. We know that brachial artery is a continuation of axillary artery beyond the level of teres major muscle. So, that is known to you. The branches are important branches. One of the most important is profunda brachii artery, the largest branch. Brachii. Profunda brachii artery. Then we have got muscular branches. Then sometimes it also gives nutrient artery to humerus bone, but most of the time nutrient artery to humerus bone is given by profunda brachii artery. It also gives superior and inferior ulnar collateral arteries. It also gives superior and inferior ulnar collateral arteries. And it gives two terminal branches. Which is the terminal branches? Which is division is taking at the level of neck of radius. The two terminal branches are radial artery and that of ulnar artery. These are the two terminal branches, radial and ulnar artery. So, done with this branches of brachial artery. Now, I want everybody to note down the branches of profunda brachii artery. So, when I am talking of profunda brachii artery, which is the largest branch of brachial artery, it passes through the lower triangular space and it is giving deltoid branch, nutrient artery to the humerus. It gives radial collateral and middle collateral artery. It also gives radial collateral and middle collateral artery, and it gives deltoid branch, muscular branches and nutrient branch to that of humerus bone. So, please write down branches of profunda brachii artery. Branches of profunda brachii artery. The branches of profunda brachii artery is following. It gives nutrient artery to humerus bone. Most of the time, it gives deltoid branch, which is going in ascending direction. It gives muscular branch. It gives middle collateral and radial collateral artery. Middle collateral artery and radial collateral artery. It gives middle collateral and radial collateral artery. Branches of profunda brachii artery. Now, we have done with the branches of brachial artery and profunda brachii artery, which are the two most important arteries. Now, I want to tell you about subscapular spaces. Subscapular spaces. So, the subscapular spaces are very important spaces which is located in the back of the scapular region. When you go for the dissection in this region, if you proceed for the dissection in the scapular region in the back, And you can see there is quadrangular and two triangular spaces. For MCQ, it is important to know the boundary of these spaces and the contents of these spaces. So here you have to know about quadrangular space. There is one quadrangular space and there is upper triangular space and there is lower triangular space. There is lower triangular space. Okay, now let's see this image. So firstly, I want everybody, actually you can use two fingers of both the hands. You can use the middle and that of the index finger, and you can just make this like this. You can just use this. Okay, and you can get a quadrangular space. You can just have a quadrangular space, and you can have an upper and lower triangular space. So you can use your fingers. Just to understand, we can see this two-dimensional image to understand better. So see here, actually here you can see there is one quadrangular space and there is upper triangular and this is the lower triangular space. So this is a space which we have to know. Now, if firstly understand the boundaries of upper quadrangular space. Upper quadrangular space is having superiorly teres minor muscle. Can you see here? Yes, this is the teres minor muscle. So this is forming the upper boundary, teres minor muscle. Lower down we have got the teres major muscle. So this is forming the lower boundary, teres major muscle. And medially we have got long head of triceps. So medial boundary is by long head of triceps, and laterally which bone we have got? Laterally we have got the surgical neck of the humerus bone. So this is the surgical neck of humerus bone. So this is forming the lateral boundary. Surgical neck of the humerus bone. So clearly we have got, and this is the long head of triceps. So clearly we have got the boundaries of quadrangular space. No doubt about that. This is QS. This is QS, quadrangular space. Yeah, I would like to use another color pen. This is QS. Okay. Now, if I talk about upper triangular space and lower triangular space, the upper boundary is again teres. This is which muscle? Teres minor muscle. Lower will be teres major muscle, and here laterally the muscle forming the boundary of upper triangular space will be the long head of triceps. If I talk about the lower triangular space, it is medially bounded by long head of triceps. Superiorly, it is bounded by the teres major muscle. This is the teres major muscle. And laterally, the boundary is formed by the shaft of the humerus bone. This is the shaft of the humerus bone which is forming its lateral boundary. So, I would like everybody to note down this. So, please note down, and then we will talk about the structures traversing. Okay. So, let's see. Please write down boundaries of quadrangular space. I am writing in short. Above, it is bounded by teres minor muscle. Below, teres major muscle. Medially by long head of triceps. And laterally, it is bounded by surgical neck of humerus bone. Surgical neck of humerus bone. So, this is the boundary of quadrangular space. Now, let's talk about the boundaries of upper and lower triangular space. So, write down boundaries of upper triangular space and that of lower triangular space. Upper triangular space is bounded above by again teres minor, below by teres major, and laterally by long head of triceps. Laterally by long head of triceps. Lower triangular space is bounded above by teres major muscle, medially by long head of triceps, and laterally by shaft of humerus, laterally by shaft of humerus, laterally by shaft of humerus bone. So done. This is the boundary for upper and lower triangular space and quadrangular space. Next, what is asked in the MCQ and is very important for you to know, the structures traversing through the space. So already the quadrangular. So see here, this is very nicely given, the quadrangular and triangular intervals, and we are knowing the boundaries. We can see the teres minor muscle above, the major muscle below, and the long head of triceps. We have already talked about this quadrangular and the triangular space. Next is to know the structures traversing through the space. That is important for MCQs. So when I am talking about this quadrangular space, two structures are traversing: axillary nerve and posterior circumflex humeral artery. Through upper triangular space, only one structure, circumflex humeral artery, which is a branch of subscapular artery. Through lower triangular space, close to the shaft of humerus, we have got the profunda brachii artery, which is the deep artery of the arm, and the radial nerve traversing. So same here also the image has been shown. In the quadrangular space we have got, here you can clearly see this is the quadrangular space, this is the upper and this is the lower triangular space. It is very important to see the structures traversing. I will give you the list. Before that, I want you to show this plastinated cadaveric image. So here a good dissection of quadrangular space is done, and here very nicely you can see upper boundary of this quadrangular space is by teres minor upper, lower is teres major, medially is long head of triceps, and laterally we can see the surgical neck of humerus. So laterally we have got surgical neck of humerus bone. Done. Now, one more cadaveric dissected image, as you can see here, the cadaveric, here we have got the quadrangular space, this is the upper triangular space, upper, U for upper, and this is the lower L. We can see the dissected muscles. So this is the teres minor muscle above, we have got the major muscle below, we have got the long head of triceps, long head, and this bone which you are seeing H for the humerus bone. Now my dear aspirants, let's write the structures traversing through the space. So all of you please note down the structures traversing through the space. So please note down. Through quadrangular space, two structures are traversing. One is axillary nerve and the other is posterior circumflex humeral, posterior circumflex humeral vessels. Through upper triangular space, we have got circumflex scapular artery, just one structure, circumflex scapular artery. Through lower triangular space, we have got radial nerve and profunda brachii artery, the deep artery of the arm, profunda brachii artery. So we have done with this. So very nicely we can appreciate the structures, upper, lower triangular and quadrangular space and the structures traversing. Now let's talk about the MCQs related to this topic. So I would like to discuss one of the MCQs related to this topic only. Which is true regarding quadrangular space? Which of the following is a true statement regarding quadrangular space? A, it is bounded superiorly by teres major, okay, bounded inferiorly by subscapularis teres minor, bounded medially by humerus, long head of triceps, contains posterior circumflex humeral artery and axillary nerve, brachial plexus herniation occurs through it. So if I talk about bounded superiorly by teres minor is wrong, it is bounded superiorly by teres minor muscle. Inferiorly by minor is wrong, it is bounded superiorly by minor muscle. Bounded medially by humerus is wrong, it is bounded medially only by long head of triceps. Brachial plexus herniation does not occur. The correct answer is the two structures traversing through quadrangular space. Just now I told you the two structures which is traversing through the quadrangular space is posterior circumflex humeral artery and the axillary nerve. So the two structures traversing is posterior circumflex humeral artery and the axillary nerve. So absolutely D is the correct answer. Quadrangular space bounded superiorly by subscapularis and teres minor. Actually teres minor is also having covering above by the subscapularis, inferiorly by teres major, medially by long head of triceps and laterally by humerus. It contains posterior circumflex humeral artery and axillary nerve. Deep artery of arm accompanies which nerve before winding around the body of humerus? Body of humerus means shaft of the humerus. Is the nerve radial? Is the nerve musculocutaneous? Is the nerve median? Is the nerve ulnar? Or is the nerve axillary? So here 5 options are given, and as I told you, whenever the word deep artery of arm is given, please don't get confused with it. Deep artery of arm means profunda brachii artery, and I told you profunda brachii artery along with radial nerve, together they traverses through the lower triangular space in close relation with the shaft of the humerus bone, that means body of the humerus bone. So the correct answer, deep artery of arm, that is the profunda brachii artery, combines along with which nerve? The answer will be A, radial nerve. So here the correct answer is A, radial nerve. Deep artery of arm accompanies radial nerve through the radial groove while passing around the body of humerus. Now, which of the following part of the humerus is correctly matched with the nerve? Actually, this is very important MCQ. If you are going to attempt for the Fmge examination, you have to know the important relation of the bony prominences and you have to know about the nerve. When I am talking about distal end of humerus, it is related with radial nerve. Whether it is correct, match the following or not. When I am talking about surgical neck, it is related to musculocutaneous nerve. When I am talking about radial nerve, it is related to musculocutaneous nerve. Medial epicondyle related to ulnar nerve. Scapular notch related to suprascapular nerve. So, it's important. I will show you various images so that you can have a clear answer for this. The correct answer is the medial epicondyle related with the ulnar nerve. Rest all is wrong. Distal end of humerus is not related with radial nerve. If I talk about distal end of humerus more medially, it is related with median nerve. Surgical neck is related to axillary nerve, not musculocutaneous nerve. Musculocutaneous nerve is the nerve of arm front aspect. So, it is not related in the radial groove. In the radial groove, which nerve is related? Radial nerve is related. Scapular notch is not related to suprascapular nerve. Actually, suprascapular notch, if the term suprascapular notch is related, then it is related to the suprascapular nerve. So, the correct answer is medial condyle is related with ulnar nerve. So, D is the correct match the following. All other options are absolutely wrong. The correct match the following is medial epicondyle related with ulnar nerve. Medial epicondyle related with ulnar nerve. Now, surgical neck of humerus is in direct contact with the axillary nerve. Radial nerve runs in the radial groove. Distal end of humerus is in direct contact with median nerve and medial epicondyle is in direct contact with ulnar nerve. So, only D option is correct. In this diagram, you can say when the surgical neck of humerus is fractured, two structures are injured. Posterior circumflex humeral artery and axillary nerve. If the shaft along the mid shaft along the spiral groove or radial groove, radial nerve along with profunda brachii artery is injured. Yeah. If I talk about the most medial part of the fracture of medial epicondyle, ulnar nerve and ulnar collateral artery gone. Supracondylar fractures will cause damage to median nerve and the brachial artery. Now, this is exactly the anterior view of the distal part of the humerus, and you can see median nerve is related in the distal part directly on the distal aspect of the humerus bone. Also, if you will see this image, you can see the scapular region, the suprascapular notch is there, and in the suprascapular notch here you can see there is a transverse scapular ligament which is making it a foramen, and suprascapular nerve and suprascapular artery is traversing through it. So, suprascapular notch is related with suprascapular nerve, not just the scapular notch. So, in this we have seen the correct match the following, and after showing you this so many images, we are clear that the correct match the following will be the medial epicondyle, which is related with which nerve? The answer is medial epicondyle related with the ulnar nerve. So, the correct option here is definitely ulnar nerve. So, got it? Yes, my dear aspirants. So, I would want to take a break for here, and we will again meet after 20 minutes, and you can take a break, and then we can start with the brachial plexus and the nerves of upper lip. Then we will cover that, and the next topic will be the thorax, important points of the thorax along with the MCQs related to the topic. So, all these points which I have written is very, very important for your coming exam, that is Fmge, and it will be highly helpful if you are going to give the next exam also, those who are aspirant for the next exam. Keep on reading. Thank you.